Hello, my name is Simone Nalatu and I'm the Director of First Nations here at Health and Wellbeing Queensland. Health and Wellbeing Queensland is an independent statutory body that has a focus on chronic disease prevention and supporting Queenslanders to achieve more equitable outcomes. Today, I'm delighted to talk to you about the work that we have been doing to address food security in our remote First Nations communities here in Queensland. I present this work on behalf of my colleagues who are listed here, who have contributed to this work to date and will contribute to it in many years to come. Before I continue, can I take this opportunity to respectfully acknowledge the traditional owners and custodians of the lands from across Queensland. May I pay my respects to the elders, both past and present, for they are the holders of the memories, the traditions, the cultures and aspirations of Aboriginal and Torres Strait Islander peoples across Queensland and in fact Australia. Food insecurity disproportionately impacts First Nations people, particularly those living in remote areas. On the McKell Institute's Food Security Index, Cape York communities here in Queensland had a food security score 60% worse of those living in Brisbane. Those that don't have the ability to buy, prepare and store healthy food because their circumstances do not allow face poorer health outcomes. And we know that poor nutrition contributes to a high burden of disease suffered by our First Nations communities. It's for these reasons that addressing food security in remote First Nations communities is a priority for Health and Wellbeing Queensland. To address this priority, we must understand the complex nature of food security. Food security is impacted by many factors and at many levels. This framework that was developed with communities has been used to inform Health and Wellbeing Queensland's submission to the federal inquiry to work with communities, government departments, industry providers, non-government organisations, the Aboriginal and Torres Strait Islander community-controlled health sector and others to identify their role in addressing food insecurity. It describes the many levels and areas of impact that we must target in order to make gains and address the barriers to food security that exist within our remote First Nations communities. Today, this presentation will focus on our work at the system level that we have been doing in our attempt to develop a remote food security action plan for First Nations Queenslanders. In Queensland, there are a total of 17 Aboriginal and Torres Strait Islander Shire councils. For this work, as part of Gather and Grow, we will be working with 13 of these Aboriginal and Torres Strait Islander councils that are located within the Torres, the Cape and the Lower Gulf regions. Health and Wellbeing Queensland's leadership in remote food security began in 2020 with our submission to the federal inquiry on behalf of the Queensland Government. During this process, we consulted with community leaders to listen and to understand the priorities for remote food security that they had identified. During these conversations, we heard the need for committed leadership with comprehensive strategy to support sustained actions, infiltrating all sectors and government departments to address the structural and systematic problems that have impacted food security in remote First Nations communities. We heard the need for the development of an action plan based on the widely recognised dimensions of food security to be able to support First Nations communities to achieve resilient and stable food supplies on a daily basis. We also heard the need to expand and build on existing innovative and practical food security solutions, programs and resources that were already in existence. The community told us the need to build an adequately resourced, trained and connected workforce in remote communities that supported identified food security actions. And finally, we needed to ensure that we establish an effective monitoring and evaluation system to measure progress and outcomes, including health outcomes. To deliver on this, Health and Wellbeing Queensland is working to develop our own food security action plan, which will be feasible, relevant and action-oriented action-oriented, with the aim to bring better food security outcomes to remote First Nations Queenslanders. To strengthen this work has been the recently enacted health equity legislation. That means that each of the 17 hospital and health services here in Queensland must develop a health equity strategy to demonstrate how they will support First Nations Queenslanders to achieve equitable outcomes. This has provided a fantastic foundation here in Queensland in which all of this work can now continue to be based on. There are well-known system barriers that negatively impact the ability to buy, store, cook and prepare healthy food in remote communities in Queensland. Over the last 3 years, we have consistently heard about the impacts of freight and supply chain, economic development and healthy housing on food security outcomes from our community members. In order to inform the development of a remote food security action plan that is relevant, feasible and delivers benefit, we needed to ensure that the voice and priorities of those who have influence over the system are centre to our conversations. We have been closely engaging with stakeholders from community, industry, academia, private and public sectors to gain knowledge, understanding and foster opportunities for collaboration. So last year, in partnership with the Torres and Cape Indigenous Council Alliance and the Local Government Association of Queensland, we delivered a series of roundtable discussions in which over 125 stakeholders participated in to provide advice to us on the solution-based actions they thought were needed to address food security challenges that we know that exist. What we heard at each of the roundtable discussions will now inform our remote food security action plan and has been documented in a roundtable report recently distributed amongst our stakeholder networks. This diagram describes the system needed to support resilient, stable and food secure communities, as told by the key stakeholders who attended these discussions. In addition, our stakeholders were able to also identify the things that would enable the strategies provided to be enacted, the things that would continue to provide a challenge, and the things that our strategy and our work should be informed by. Some standout themes include distribution hubs, local food production, data and information mapping, particularly of the supply chain, reliable white goods and healthy home practices, resilient freight and transport infrastructure to protect against weather events and climate change. We're delving deeper now into these themes to understand the actions required to make changes in this space. We continue to liaise with technical advisors, partner with industry and content experts, and importantly, continuously seek community input and feedback to ensure our activity reflects community needs, priorities, and wants. The result of this will be an action plan that supports First Nations communities in real ways that deliver benefit to health and wellbeing. Thank you again for the opportunity to present the work that we are doing in Queensland related to addressing food security in our remote First Nations communities. If at all you have any questions or would like any more information on the work presented here, please feel free to contact me on my details provided here. Thank you again.